Hello, good evening. Today we are going to discuss muscles of mastication. Muscles of mastications are temporalis muscle, medial pterygoid, lateral pterygoid, and masseter muscle. Before going for the muscles of mastication discussion in that masseter muscle, first we will discuss parotid-masseteric fascia, which is arises from the deep cervical fascia and covers the parotid gland and masseteric muscle. That's why the name it is called as the parotid-masseteric fascia. It arises from above the lower border of the zygomatic arch and it covers parotid gland behind and anteriorly it covers the masseteric muscle. Now coming to the masseter muscle, which has two portions, superficial portion and the deep portion. Now coming to the superficial portion of the masseter muscle. It is arises from the tendinous, thick tendinous from the zygomatic process of the maxilla and the anterior border of the lower surface of the zygomatic arch. And after arising, we can see here this is the anterior border of the zygomatic arch, lower surface and anterior border of the zygomatic arch. This is anterior border and this is the posterior border. Fibers runs downwards and backwards and inserted into the angle of the mandible and lower half of the lateral surface of the ramus of the mandible. And the deep portion of the masseter muscle, which arises from the posterior two-third of the lower border of the zygomatic arch and the whole medial surface of the zygomatic arch. The fibers of the deeper portion of the masseter muscle, which runs forward and downward and inserted into the upper half of the lateral surface of the ramus of the mandible. This is the upper half of the lateral surface of the ramus of the mandible and also to the lateral surface of the carotid process of the mandible. And the deeper portion, which is covered by superficial portion of the masseter muscles anteriorly and posteriorly it is covered by the parotid gland. The temporalis fascia cover the temporalis muscle and the temporalis fascia laterally covered by auricularis anterior and superior and by gelia aponeurotica and also some part of the orbicularis oculi. And superiorly it arises from the temporal line. We can see here it arises, fascia arises from the temporal line. This is the temporal lines which are going backward, upward and again it coming back downward. And this is the superior part. And when it come to downward, this attachment of the fascia which has two portions. One is attached to this lateral surface of the zygomatic arch and one more portion to the medial surface of the zygomatic arch. Superiorly, this fascia has one layer and as here we can see this is the zygomatic arch. It divides into two portions, one attached to the medial surface and another one attached to the lateral surface of the zygomatic arch. And superficial temporal vessels and auriculotemporal nerve which crosses the temporal fascia from below to upward in the pattern of the from below to upward. Key point to remember here is the superficial temporal vessels and auriculotemporal nerve which crosses the temporal fascia, not the temporalis muscle. It will get confused, so key point we have to remember. And between the two portion of the fascia which is inserted into the zygomatic arch, the adipose tissue, and the orbital branch of the superficial temporal artery, and portion of the zygomatic branch of the maxillary nerve will be present in the two portion of the fascia. Now we will discuss the temporalis muscle, which is arises from the whole of the temporalis fossa and deep portion of the temporalis fascia, and the fibers are runs and downwards and passes between the or behind the zygomatic arch and inserted into the, we can see here, this is the medial surface of the coronoid process, and fibers inserted into the anterior border of the, you can see here, this is the anterior border apex, also anterior border of the medial surfaces of the coronoid process. This is the insertion. Now we will discuss medial pterygoid muscle. It is also called as the pterygoid internus. This muscle arises from the medial surfaces of the lateral pterygoid plate and also from the groove of the pyramidal process of the palatine bone, and another slip arises from the maxillary tuberosity, and these fibers are runs downwards, backward, and lateralward, and fibers inserted into the tendinous lamina into the back and lower part of the angle of the mandible and medial surface of the ramus of the mandible. This is the medial surface and angle of the mandible. Here we can see here the tendinous lamina, which the pterygoid, medial pterygoid muscle or pterygoid internus muscle will inserted. Now we will discuss lateral pterygoid muscle. It is also called as the pterygoid external, and it has two parts, upper part and lower part, and it extends from the infratemporal fossa to condyle of the mandible. Now coming to the origin of the upper part of the lateral pterygoid muscle. It is arises from the lateral surface of the greater wing of the sphenoid bone and crest of the infratemporal fossa, and the lower part which is arises from the lateral surface of the lateral pterygoid plate. We can see here, this is the lateral surface of the lateral pterygoid plate, and also we can see the crest of the, here we can see here, this is the lateral surface of the greater wing of the sphenoid bone, and fibers of the lateral pterygoid muscle which runs horizontally backward and lateralward and inserted into the depression in front of the neck of the condylar portion of the mandible. We can see here, this is the depression. Here the lateral pterygoid muscle will inserted, and also the lateral pterygoid muscle inserted to the anterior margin of the articular disc for the TMJ articulation. The muscles of mastications are supplied by the mandibular nerve. Now coming to the actions of the muscles of the mastication. Here we can see, this is the action of elevation of the mandible towards the maxilla. This action is produced by the temporalis, masseter, and medial pterygoid muscle, and we can see here, this is the one more action, this is the depression of the mandible from the maxilla. This is by lateral pterygoid muscle, and this is the protraction of the mandible. This action is produced by the medial pterygoid muscle and also with the lateral pterygoid muscle. Here we can see, and this is the retroposition or pullback of the mandible is produced by the posterior fibers of the temporalis muscle. When the medial and lateral pterygoid muscle each other act, there will be side to side movement, and in case of grinding along with medial pterygoid and lateral pterygoid, temporalis muscle also join. Complexly, these three muscles act as a grinding movement while having the food. Thank you.